It's Dr. Jen Unwin and Charlotte Summers.
Hello, thank you so much for staying and not all disappearing right before the end. Jen and I are really excited to be speaking to you today about sugar addiction, and I think it's something that sits slightly outside of some of the other presentations that we've seen today. We want to show you a little bit about the science, and then we want to show you about a little trial that we've been running on diabetes.co.uk. I think the first thing that we wanted to just kind of present to you is why we are actually here. And we're here for 3 words, and that is that we empower people. So as diabetes.co.uk, I've been so lucky to be working with such inspirational doctors and healthcare professionals and experts in various fields. And that includes many of the people that we've heard present today, as well as many others. And essentially what we're doing from diabetes.co.uk, the world's largest and most engaged patient community, is we're empowering patients by looking at their engagement, we're looking at their improvements in A1C, and we're looking at improving their mental and emotional well-being.
Okay, so this is a bit of an overview of what we're going to try and cover in the next sort of 40 minutes. We're going to broadly be exploring the question of, is food addictive? Because there's some controversy about that. What might be some mechanisms of addiction, if we think this might be a kind of useful thing to explore. I'm going to do a bit of a quick review of the studies that are out there already for people with diabetes, both type 1 and type 2. And then, as Charlotte said, what's really interesting is we thought would be really nice to look at some data that's already coming out of the DC UK populations. We're just starting on this really, so this is really kind of initial data, and we do really hope to do a lot more work on this. So you're just kind of seeing the first time we've talked about this, and there may be some ideas about what's next and some references if anyone wants to follow things up, and obviously questions. So that's our overview. So we thought it'd just be interesting to take a poll. I know we're very kind of biased sample, as one would say. We all have our kind of view, and we've sort of come together because we have a lot of shared things in common here, don't we? But just have a show of hands, just for people who actually think that food, particularly sugar and refined carbohydrates, are an addictive substance. That's everybody, basically. Great. Yeah. It's so interesting. Pretty conclusive. Okay. Right. So now we're going to channel our inner Zoe Williams, and partly because it's the graveyard shift as well. We're going to get people, if you're willing to play along, and if people are watching the video later on at home, they can play along as well. So we're going to incorporate a bit of exercise with a bit of self-assessment. Play along if you want to. Don't if you don't. I will be asking people things, but nobody has to contribute unless they're comfortable to do so. So what I'm going to be asking, or we're going to be asking you to do, is to stand up if the following statements are true for you or have been true at a time in your life. So I'm guessing, partly, that a lot of people obviously acknowledge that food is an addictive substance here. A lot of people I talk to have kind of found this approach partly as a way of getting control back in their lives. And so quite a few of you sitting here today are probably, these things won't be true of you right now, but if you can pick the time in your life when you struggled most with this, and perhaps think about that time, the substance in question, of course, that we're talking about is sugar or foods containing sugar or highly refined carbohydrates, such as white flour, potato and rice starch. David said I had to include chocolate, so people were really clear that that was one of the things we're interested in. And obviously all those refined, we've heard that throughout the day, that starch is broken down into glucose, sugar. Keep a personal count of every time you stand up. So each statement will come up, you'll stand up if it's applied to you, okay? And then as we're going along, keep a personal count of every time you stand up and sit down. Is this too complicated for this time of day? No, hopefully not. Okay. So we shall proceed. Okay,
so the first one is taking the substance in larger amounts or for longer than intended.
Stand up if that's ever applied to you. And be keeping a count. So all of you who've stood up, you've got a score of 1. And if anyone's willing to share. I've been chatting to people in the lunch break, a few of us that I am a sugar addict, a few of us that have got some real horror stories about the larger amounts of things that we've eaten when we've felt extremely out of control with our eating. I don't know if anyone's comfortable to share one example that was in their mind as they stood up. Is anybody? Rob?
Well, I'll share one about my father, which is David.
Stand up, David, stand up.
Stand up. One time on holiday, he ate 3 lemon meringue pies.
Whole ones. Whole ones. It's true.
We all thought a banana this morning was bad.
Yeah.
My word.
It's true. We went on a family cookery day, and there was 4 or 5 of us in the family, and we all made a full-size lemon meringue pie like that, and David ate 3 of them. Only 3? Yeah, lightweight. Okay, so our next one is stand up if you've ever had a feeling of wanting to cut down or quit this substance but not being able to. So slightly fewer people. If you've stood up, of course, be counting. So you've either stood up once or twice now. Keep a score of that. Again, I've got a story of that, which was I always knew I'd be kind of building up and eating too much sugar and wanting to go on a diet. I think we've all kind of done this, haven't we? And we've said Monday. Diet's going to start on a Monday, cut back on Monday, and you'd rev up over the weekend eating your 3 lemon meringue pies or whatever it was, because it was the last hurrah and you knew change was coming. Come to Monday, you get to about 3 o'clock in the afternoon and you just weren't able to kind of make that change. So I don't know if anyone else has got a story that they've got to share about trying to quit and not being able to. Thank you.
Yeah, I fell back into crap sugar after Christmas, and the harder I tried to give it up, the worse I got. I had 3 Yorkies and a whole bag of integral while watching a movie.
Yeah.
Cinema. I felt sick afterwards and still kept doing it. So
It's really hard.
to Lowcarb and
Yeah.
12 pounds in about 30 days.
In the group, I think people know that we run low-carb groups to support the patients in David's surgery. Let me tell you, Christmas is a scourge for people, and sometimes people disappear for at least 6 months before they manage to get back in control. It's a really difficult time.
We had that when we launched the low-carb programme as well. We launched it on November the 14th, so World Diabetes Day in 2015. 6 weeks later, Christmas came, and everything just fell apart. And when we were looking at the data of people who then came back onto the programme, these kind of addiction tendencies were one of the things that came up. So it's really interesting that you say that as well.
Yeah.
So the next one is spending a lot of time obtaining the substance.
There might be fewer people for
Yeah.
this, but yeah, a few standing up. Thank you. I think the thing is, isn't it? Keeping account still. One of the problems is that we live in a society where we don't have to go and find our drug dealer down the back of some hideous alley, because we only have to step out of the door into the local co-op, and it's right there. Or probably we've bought a whole load of stuff and it's in the cupboard. But my friend Libby that I was speaking to at lunchtime had do you mind sharing?
Do you want the chip story?
Oh yes, please.
I'm a recently retired midwife, and as all people in acute NHS, I used to do, 12, 13, 14, 29-hour shifts with no breaks or whatever. And if someone, I used to weigh 21 stone, by the way, that was 10 years ago, type 2 diabetes set me free. And if I was on shift and someone mentioned the word chips, you would find me in my car at 11 o'clock midnight, driving round Leicester, frantically trying to find somewhere open so I could have a bag of chips. And I'd get back in the car, and before I turned the car engine on, the chips went down, and that was it. That just carried on for a few days. We've all been there, haven't we?
Yeah. Thank you. I know I'm kind of aware that we're laughing about some of this, but actually personally it's incredibly upsetting, because it's awful to feel out of control like that, actually. And we're all intelligent, sensible, do kind of amazing things in the rest of our lives, and to actually feel that you're so driven by the Q word chips to drive around Leicester, or to eat 3 lemon meringue pies, you know that's it's kind of crazy, and of course for a psychologist that's actually quite a mental struggle internally to be watching yourself do crazy stuff is, it's a bit difficult. Is that me?
Yep.
Craving or having a strong desire for this substance, I know that's going to get everybody up. Yeah. Okay, yeah. I don't think we even have to give an example. Obviously craving the chips or whatever it is. Yeah. Thank you. Be keeping count, everyone.
The next one is being unable to carry out obligations at work, school, or at home as desired.
I don't think that would be so many people.
Not
Some people, yeah. And obviously, if you get very ill with diabetes or extreme overweight, then that's going to be an issue. I don't know if is anyone willing to share on that?
I'll share.
Thank you.
This is so embarrassing.
You're safe here.
When I was actually diagnosed officially as a type 1 diabetic, because I got it as an adult, with a late onset, some bizarre thought went through my head, which I'm going to blame it on high blood sugar. And I thought, oh, well, I'm just going to die anyways. And at that time, I was obsessed with licorice. So I may or may not have eaten 2 whole bags, which is almost a kilo of licorice. Lord knows how to land up in a coma. But anyway, that was the end of me for work for, I think, 2 or 3 days.
Okay.
I was so violently ill.
Yeah. So that's a real example of how we're damaging ourselves, and those of us who are lucky not to have got to the point of being diabetic, even so we're damaging our health by doing this, aren't we? Okay, continued use despite persistent social or interpersonal problems linked with the substance. I didn't particularly have kind of major interpersonal problems, but I knew that it upset David he doesn't know all the things I used to do, but some of them he was aware of, and it's upsetting, isn't it, to see a partner, doing themselves harm. Anyone else willing to share? Don't feel you have to. Thank you.
So stopping or reducing important social, occupational, or recreational activities due to the substance. I guess that kind of crosses over with the last point.
Stand up if that applied to you, and be keeping a personal count. So that might be things like, for me, I wouldn't go swimming, for example, which we used to quite like to do as a family. I just wouldn't go if I was over a certain weight, which is exactly what you're saying. So I was cutting down on kind of things I would have done.
Yeah, I know it could in terms of the importance of the change. When I was diagnosed, I used to have to sit down if I washed the pots. I was very glad I had it.
Yeah.
Last month, I did 25,000 steps a day whilst climbing mountains in Japan on a backpacking holiday with my 5-year-old nephew.
Yeah, brilliant.
It's a completely different thing.
Yes, thank you. Thanks for everyone's. Thank you. Thanks for everyone who's sharing their stories. I know it's not easy. Right. Is that me or you? Can't remember. Yeah. Continued use despite persistent social or interpersonal problems linked to the substance. I think it's a bit like the last one. Nobody's standing up for that one. Use of the substance in hazardous situations. Now, we were having a little think about this at lunchtime, and nobody stood up, but we were saying that, and I don't know who else identifies with this, sometimes on the last hurrah, on the Sunday, before the rain in on the Monday, I would find an excuse to drive off to some garage or chocolate outlet and buy a little stash and put it on the car seat and eat it on the way home before I got home and anybody knew that I had it. And so let me tell you, unwrapping a Caramac at high speed, and as Libby points out, some of it drops in your lap, and then you're trying to, I'm sure that's more dangerous than even using your mobile phone while you're driving along, so sometimes that can happen. Continued use despite persistent social,
Yeah, I think we're going backwards.
Are we going backwards, although I'm doing next?
That's right.
I'd like to point out, that previous slide, the one about continued use despite you've got social and interpersonal problems.
Mm-hmm.
Well, I think about, I only gave up sugar 4 years ago, and I had no end of trouble with my teeth, lots and lots of expense and pain, and I hate going to the dentist, but I'd feel I have to go, otherwise I'll get an abscess. And you think I did that for 50 years, if you know what I mean.
Yeah.
And so it's an awfully long time, and obviously, like, for 4 years, I've had a lot less dental trouble, a lot less expense, a lot less time spent at the dentist, and that's, my social life is much better because I don't have to spend so much time at the dentist.
Yeah. Yeah. So this one actually is different, and it's continued use despite physical or psychological difficulties that you're aware of. So that might be that you were diagnosed with type 2, or you were type 1, or you knew it affected your mood or your mental health in some way. Has that been the case for anybody?
Mid-afternoon sleeping.
Napping on the consultancy couch. Right.
One of my colleagues said he fell asleep in the consultation and he was really embarrassed after a heavy meal. And that happens. A lot of us had trouble staying awake in the afternoon, didn't we?
Yeah. Okay. Thank you. And a need for increased amounts of the substance to get the same desired effect. I know this is true. Yeah. So over time, just needing to eat more and more.
That family-sized galaxy.
The family size, and these family-sized things, and like the family-sized Doritos, no problem, get rid of them. Cravings and other physical symptoms of withdrawal if the substance is not available and the symptoms are relieved on consumption. Yeah, very good. Yeah. It's that kind of hangry thing, isn't it? And then you feel better afterwards. Okay. Right. Everybody stand up. And if you're still willing to play along, sit down if you've got 0. If you scored 0 on any of those, congratulations, that must be just amazing. Sit down if you've got 1. So very few people sitting down. Okay. All of those of you still standing up have a mild addiction to sugar. Shall we carry on, or is that embarrassing enough? Okay. Don't play along if you don't want to. Sit down if you don't want to play along. But okay, sit down if you've got 2. Sit down if you've got 3. Hardcore now. Sit down if you've got 4. Fewer people. Sit down if you've got 5. Still a few people. Should we leave it there? Thank you. Thanks, everybody. Really appreciate you playing along. Those were actually the DSM-5 criteria for substance use disorder, which is generally used for drugs of abuse, obviously, such as cocaine and heroin and so on. The DSM is the Diagnostic and Statistical Manual for the diagnosis of mental health problems, so mental disorders, and it doesn't consider sugar and food to come under the category of substance use disorders. You would probably, if someone was, I don't really approve of the DSM, but if you were trying to categorise all of us, you'd probably say that we had, at that time that we're talking about, an eating disorder not otherwise specified, so not anorexia, not bulimia, although some of us may have had aspects of that. So there we are. So in this room, I would say there's a very high proportion of people who were struggling with sugar. So what might be some of the mechanisms to help us understand this struggle, this real struggle? And here's the 4 I'm just going to run through quickly. Hyperpalatability, the tryptophan serotonin relationship, the dopamine rewards motivation kind of pathways, and a kind of a learning from negative reinforcement, a way of sort of reinforcing behaviour. So firstly, I'm going to stand there because I don't have to keep doing that. Yeah. Hyperpalatability. So if you read one paper actually on sugar addiction, I would read Di Nicolantonio's paper, which came out last year, because he kind of summarises a lot of this. And he says that sweet sensations are one of the most intense sensory pleasures, certainly for us lot in the room. That seems to be the case, doesn't it? We get a massive natural reward from seeking sweetness. And obviously that's been driven a few people have referred to this kind of evolutionary perspective today about how we're driven to seek out high-calorie foods and then kind of lie around and conserve that energy. So obviously we were driven to search out sugar. and there wasn't much of it about actually, but it was great in the autumn to be able to have the brakes off and just carry on eating because then we would be laying down fat for the winter. There does seem to be evidence that some of us are more susceptible genetically than others, and my mother was certainly, looking back, now I understand this kind of concept of it, my mother was certainly a sugar addict, so I don't know if does that apply to other people who feel they're strongly sugar addicted, that there's a thing in the family going on. Yeah, that's why we're here. We're the survivors. And in fact, my mum used to say that. She used to say, God, I'd have made a great cave woman. She could live on 50 calories or something. she was really efficient metabolically. The trouble is, of course, as we all know, we just live in an utterly sweetness and refined carb saturated environment. And the refinement of it significantly adds to its addictive properties, as does, obviously, cocaine is a lot more addictive because it's refined down, and same as opium from the poppy. Okay, and the food manufacturers exploit this hyperpalatability, as we know. Look at all Zoe was showing a thing, wasn't she? Look at all the stuff that's in Pringles, and they even have the tagline, don't they? You can't just eat one. A lot of this stuff is actually sugar. So potato, rice, dextrose, sugar. There was another one, wasn't there, Debbie? Sugar, corn syrup, sugar, and there's this kind of bliss point with salt and sugar that they actually did research to find it. What's the most irresistible combination? So the hyperpalatability, the food manufacturers have exploited that. Tryptophan is quite interesting because it's the precursor of serotonin, which is the kind of feel-good neurotransmitter, and it normally competes with other amino acids to get across the blood-brain barrier. Now, I think this is probably another thing that insulin does, but I don't know enough about it, so if anybody does, they can come and tell me more about it later. But in the presence of sugar, tryptophan is preferentially taken up. The channels seem to be open to tryptophan, and so you get a nice boost of serotonin, and we feel all relaxed and kind of sleepy after eating sugar. But some people think that if that's repeated, that the brain becomes depleted of serotonin, and of course you're using up all the tryptophan. And what people like me used to do is that the sweet and refined carb foods crowd out other nutrition because you go for those preferentially, and tryptophan's naturally found in all the good low-carb stuff like nuts, cheese, and red meat. So you're probably eating less of that. So over time, that's depleted. So again, this is part of the have to eat more and more mechanism. Dopamine is the brain hormone which is extremely strongly linked to reward and motivation. So we tend to focus in and we tend to repeat the things that give us that dopamine buzz. It's a way of kind of learning what's good for us in a way. So unfortunately, in this case, we're tricked because it's released on the consumption of sugar. And over time, the brain downregulates its dopamine receptors, exactly as happens in the brains of people who are addicted to other substances, such as cocaine and alcohol. And that's what leads to sugar withdrawal symptoms, craving, and increased consumption over time again. And people have all heard this study because it was massively in the news about the lab rats who they trained up to be addicted to both. They were having a great time there in the lab. These rats, high on cocaine, and they were given sugar. But if you gave them a choice, they chose sugar over cocaine. So there's loads of reasons why it's difficult to give up sugar and stick to it. And the other thing about dopamine is, again, this focusing down, because you get the buzz of dopamine means that's a thing you're going to try and pursue. So you focus down, you give up other things in life that might give you a good dopamine feeling to focus on pursuing the sugar. Negative reinforcement's an important one, and it's one that you don't see so much in the literature, but as a psychologist I would understand that any behaviour that reduces a negative feeling state is reinforced. Okay, so obviously you can reward somebody with a good thing and that makes them do that behaviour again, but also if they do something that makes them feel better or takes away a negative thing, that's also reinforced and they're more likely to be repeated. So obviously we've already said that consuming sugar, etc., relieves those withdrawal symptoms, that grumpy low sugar feeling, you're more likely to repeat whatever behaviour came before that, which is driving to the garage to get your Caramac or whatever it is. And very strong habits can be formed around certain foods, like people will have their, all of us who stood up will have our favourite kind of crack cocaine version of whatever it was that was our favourite thing to eat. And that's exactly the same, this reward habit thing is exactly the same as caffeine, nicotine, alcohol. We all have our favourite coffee mug, we have our favourite coffee outlet, we have like the way our tea is made, we don't want the milk in first, we want it in second. It's very habit kind of, we like it how we like it personally. Okay, now the other thing to say here is that I wondered when I was thinking about addiction whether this might be doubly important for people with type 1s because they've got the added fear factor of when they get the low feeling of the fear of hypos. But we didn't know, but that was one of my hypotheses, was that it's possible that there are quite a lot of sugar addicted people who are type 1, but we didn't know. Okay, this is just to illustrate again the crazy world we live in. There's a shop called Sugar Fix, so it's almost as if the manufacturers are exploiting this idea. They know that sugar is addictive and they're kind of playing on that. And again, look at these Snickers bars with these wrappers, sluggish, fuzzy head, knackered and grumpy, which are the signs of sort of sugar withdrawal, and they're actually marketing it as a kind of sugar withdrawal fix. We live in a crazy world. And again, it's as if society's kind of laughing about sugar. Ha ha ha, we're all sugar addicts. Well, it's not very funny, really, is it? And also, again, the advertisers trying to sell stuff. Cookie dough dynamo was my favourite, but Ben and Jerry's trying to kind of sell it as it's a good thing because it's got no GMOs in it. Ice cream. So cultural factors. We live. This is the thing that annoys David. This kind of treat yourself. You're worth it. Treat yourself world. Office cake. Where's my office cake friend, lady? Yay! Tell them about your...
Oh, thank you. Sorry, 2 minutes. I have
1 minute.
1 minute, 30 seconds. I've done research, which we think is the first research into office cake culture in the UK. My master's in obesity and weight management, and I studied office cake culture, and I found that actually there was all sorts of things that I found, and come and ask me afterwards and after the links, but 95% of people, there are 1,000 people in this study, 95% of the respondents actually agreed that whatever they thought about office cake, whether it was the work of the devil or it was the best thing ever, 95% said that once a week or less was probably enough. And I think that's a fantastic opportunity because there's a point of consensus, and I'm working very hard, not very successfully, to get into workplaces, talking to health and well-being practitioners and HR people to try and help work with that data to try and get individuals to realise that they've got a lot in common, and perhaps we can get rid of the office cake without anybody needing to mandate it, because it's actually what people want. If only we could get it.
Well done, thank you.
Thank you. Whitehall about a year ago, didn't get a good response.
Yeah, thank you. And, just obviously do what we can do in our workplaces, maybe by leading by example, but, just what we all know the world we live in, and actually those of us that don't eat sugar is kind of seen as the crazy people. Right, okay, so quick run through the literature then. There's not masses on it. The references are at the end. There's quite a number of people writing about a food addiction, saying it's a real thing, and obviously talking about it, and there's a whole book on food addiction, and we can give you the reference for that if you want. In terms of who doesn't think food addiction is an actual thing, there's the DSM-5, as I've said. They don't consider it to be a real thing. And the other was this paper by Westwater that came out. So I channeled my inner Zoe and Marika, and I had a little look at that one. And the paper itself is was sponsored by RIP Health. Has anyone heard of RIP Health? Yes, yes. So,
my hero. I know he was my hero, so I understand.
So I googled RIP Health, and here are their sponsors, people: Kraft, Coca-Cola, Dr. Pepper, McDonald's, Kellogg's, the Corn Refiners Association. The latter reportedly sponsored RIP Health $10 million over 4 years. And this, I actually saw, I went and found that, so that does exist. New York Times, Dr. Rip received a personal $41,000 a month retainer from the Corn Refiners Association, and he presented to the American Academy of Pediatrics in 2010 at a sponsored event to educate doctors about the harmlessness of high fructose corn syrup. So, I just leave you with that. Okay. Right, so what does the literature say about food addiction and diabetes? Approximately, and we seem to be all in this room, 5 to 20% of the general population are thought to be food addicts. I think it's probably higher. 80% of those people are struggling with being overweight and obese. And I'm sure this is true. Food addiction is strongly linked to other substance abuse. So this idea that actually sugar is a bit of a gateway drug through to other things like alcohol. People are often also drinking, maybe smoking, maybe taking other drugs. Food addiction hampers weight loss efforts. And I've already said that. We've got that twice. We've just got that twice. Yeah. Okay, it's copy and pasted, yeah, sorry about that. Okay, in type 2 diabetes, there's a really wide, these were the kind of extremes, if you like. There's hardly any literature, but Raymond and Lovell did an online survey of 334 people, but really that is definitely an overestimate, because what they did was they put out saying that they were doing a study on food addiction on Diabetes UK and the Australian diabetes site. So they got a 70% prevalence. And Yang et al. Did a case series of 312 newly diagnosed outpatients in China, and they got 8.6. So there's just this massive kind of, obviously more research needed. Okay, so what I'm going to do is hand you over to Charlotte, who's going to talk about what we were trying to look for, how we got the data, and then some initial results.
Yeah, so these are really top-level results, and we've only really been collecting this data for the last 6 to 8 months. So one of the things that we wanted to understand is what actually is the prevalence of sugar addiction and food addiction within the diabetes.co.uk community. We wanted to look at the different types of diabetes. So as Jen was saying, the breakdown between the different types is not really there within the evidence. So we wanted to see if there was a particular type of diabetes that had a greater prevalence. We also wanted to have a look at people...
I should say, it didn't come up, but there are no papers at all on type 1. No papers at all on type 1 and food addiction in the literature. If you search for it, Google Scholar, nothing. Nothing.
And so we also wanted to look at the number of people that were food addicted within the low carb program. So potentially a self-selecting model where they more or less likely to have sugar addiction on the basis that they were opting to go low carb off their own backs. And then what we were looking at is whether or not a low carbohydrate approach, in this case the low carb program, could be a suitable treatment pathway for people who are experiencing symptoms of food addiction. And then obviously subsequently, could that then mean that people that go on the low carb program then experience fewer symptoms of food addiction? So we use the Yale Food Addiction Scale, which is one of the most commonly used scales in a lot of the literature and in a lot of the work that we were looking at. It's essentially a self-reported 25-question questionnaire that talks about different elements similar to what we've just done. And what we scored it on is that either you're addicted or not addicted, but it can also be scored on a scale, so we can maybe look into that data next. And of the undergraduate norm that they used, obviously as a standardised survey, it's around 11% of the population were coming out as having addicted tendencies.
If we consider undergraduates to be normal, which they're not really, are they? Because they're all of a certain age and you know, to some extent socioeconomically skewed as well, and tend to you know, have not great health habits probably. So those are the norms that are around.
Our current norms.
Our current norms, yeah.
So the sample size that we were using, we were collecting 2 data sets. We were collecting one on diabetes.co.uk as a general cross-population analysis, and then looking at the low-carb programme. So we had 43 people with type 1 diabetes who responded to the survey, and there was just under 30% of those were addicted to sugar, according to the score. Of the type 2 population on diabetes.co.uk, we had just over 250 people, and just under 15% of people were addicted. And on the low carb programme, that was actually a bit higher. So we were seeing around 25% of people addicted to sugar who had opted in for the low carb programme. And for people with pre-diabetes, again, quite a small sample, well, a very small sample, but we had 16% of those 31 people that were addicted to food of some description. We then wanted to understand if the low carb programme or the low carb approach is an appropriate way of managing food addiction. So if we do reduce your carbohydrates, if you do go through the programme, are you actually able to reduce your symptoms? So just a quick note, I'm sure most of the people in this room know the low carb programme, but it's a 12-week behaviour change programme that's completely digital and online. It's empowering the patients to go and have a conversation with their healthcare professionals, and the relationship is fueled that way. Each week we talk about a different element of your diet and talk about how to reduce the sugar or carbohydrate content. And in the last 2.5 years, we've had over 308,000 people around the world who have gone through this programme. It's available on lowcarbprogram.com, and it also has a healthcare professional platform as well that we are really pleased to share with you in a couple of weeks. Essentially, the guidance within the programme is looking at sugar from 3 sources, so whether that be natural, added to foods, or as a result of complex carbohydrates, we're talking about reducing the overall sugar intake. So in the programme, we use things like breakfast, so we've kind of spoken about this already, but we very much utilise the teaspoons of sugar equivalent. As we found from a patient point of view, it's not really useful to be talking about grams of sugar per 100 grams. That doesn't really mean as much. So we would compare a typical breakfast, as we've seen today, of bran flakes and wholemeal toast and fruit juice, with the kinds of breakfast that we would be encouraging people to eat on the low carb programme. So a 3-egg omelette, it's cooked in butter, you can have your coffee with full fat milk. When we look at these 2 breakfasts in terms of the sugar, I'm sure it's not going to be a surprise to anyone that that first option has more than 16 teaspoons of sugar, and that second one has less than 1. So, taking all of that into account, is the low carb programme or the low carb approach a suitable way of reducing sugar addiction? And these are the results that we found. So we followed the low carb programme as a 12-week intervention. We followed people up at 6 months after they joined the programme. So you can see at the beginning, we saw around 25% of people with type 2 diabetes that were addicted to sugar. And at the 6-month point, we were seeing around 7 or just under 8% of the people of the population. This was actually a significant difference as well, statistically significant difference. So arguably maybe the low carb approach, in whatever capacity or guise that may be, could be an option for people that are addicted to sugar. And that then brings us to our conclusions.
Yeah. So it seems like, and it sounds like you guys all agree, that the concept of food addiction has utility. It seems to make sense in terms of our own experience, but also in terms of people we're trying to work with. Obviously, masses more research is needed on this. I think the trouble is that there are these papers saying that food addiction, that there isn't enough evidence yet to say that food addiction is a real thing. So then there's not going to be so much interest in people doing research in it. So it will be up to people like us to sort of keep pushing that, really. It was interesting, wasn't it, that there was actually double the rate in this very small sample, caveats hedged about. But I think this whole issue of food addiction for people with type 1 diabetes is really important for us to sort of look more into that and get more data on that. It seems a sensible step, doesn't it, that people would be screened for food addiction if they were being newly diagnosed with any form of diabetes, really. And I think also important is that, you know, given all of that the current advice to be moderate, which is that thing that drives us all mad, rolling of eyes, in sugar intake makes no sense. It's very poor advice for people who are coming up high on this you know, if you were screening high on sugar addiction, in the same way as you would not advise an alcoholic to be moderate, or you wouldn't say just one glass of whiskey, which is what happens, isn't it? You're at a party and people, you know, people who know, and we've even said, you know, I don't eat that stuff, I can't control myself around it. You know, we might have said to people, oh, one cake. And it's as if people, it makes them feel better if you eat it somehow. So you have to be quite assertive not to have it. But the current advice for moderation, a proportion of people will not be able to do that. And then that just compounds this feeling of powerlessness and I'm slightly crazy compared to the rest. You know, if other people can do moderation, why can't I? We all know people who can do moderation, but some people can't. And so the indications are, and again, we're going to be looking into this a lot more, that low carb eating seems to help people. Let's keep looking at that. And as I say, maybe a lot of us have gravitated here as a way of helping ourselves with that. And also we want to be looking more at the data which Charlotte has got around mental health. What are the links with sugar addiction and mental health, and also with the blood glucose outcomes. Do you want to say anything else?
Yeah, no, that's fine.
Yeah, there we go.
These are just some jazzy new ways that we're looking at sugar addiction or food addiction. So we're just exploring utilising different realities and how we can reinforce the positive behaviour of saying no to certain foods. So this is utilising a lot of the research that's been done on people that are addicted to alcohol. So if you can practice seeing that drink in front of you and saying no to it, does that reduce your propensity to drink it when you're in a real life situation and that's available to you? So we've got two things. The first one is a virtual reality environment. I think if you press the forward button, it'll basically the way...
It'll help you to learn which foods you should keep in the cupboard and which ones you should avoid. Now you'll see a range of foods pop out in front of you. Now simply shoot the target attached to any bad foods, anything you think is high in carbohydrates. We'll give you the results at the end. Ready? Let's go.
So this is our virtual reality kitchen, and there's lots of bananas on the table.
Shoot them! Shoot them!
So this is a very early prototype, but we're just doing some work with a couple of universities and institutions that once we've collected baseline data, so a couple of things. So the score is actually attributed to the amount of sugar in that particular food that you're seeing. And what we're doing is looking at if there is a delay in shooting certain foods, does that indicate that you potentially have a higher affinity to that food? You're less likely to want to get rid of it and less likely to shoot it.
I have to get you that, David. You enjoy that?
Yeah. So that's that's a very early prototype, and then the image on the right is an augmented reality application. So this is something that you would utilize with your mobile phone. You would scan the barcode of one of the foods that you were proposing or deciding whether or not to eat, and it would come up with the heads-up display that says, this is the nutritional values, this is how much sugar is in that, and then you have the option, Tinder style, to either swipe it into your cupboard or into the bin. And so we're reinforcing that behaviour of actually moving those foods into the bin and seeing if that has a positive effect on whether or not you're likely to then go on and eat it. So they're just a couple of the ways that we're just exploring and collecting more data, just looking at how we might be able to utilise these different technologies that are available to us now to really utilise the education around sugar addiction and food addiction as well.
Yeah, and we're thinking about definitely screening people who are coming into the low carb program and doing something different with people who are coming up very high on sugar addiction, doing some special modules for that as well. Okay, so those are the references. I think they'll all be going. The talks will be going up, won't they? So obviously, if you want to pursue those or come and talk to us afterwards, we'll be around.
Excellent. Thank you very much.
Thank you.